such an international agreement. And that perspective incorporated or was based on several understandings. So I'll just mention a few. One was that it was understood that the biological and social roles that are imposed on women many times have a big impact on population trends and dynamics. So, on fertility levels and on migration, on all the, demographic trends. It was also understood that too often women's reproductive role is emphasized over the productive role that women have in society. And even so, their reproductive role is not always given the value and the support that is needed. And therefore, women are not supported in making choices and in being able to really control their own destinies. And they're not even really supported in their caregiver role, because they are the major caregiver in most families, households, and communities. In Cairo, it was also understood that girls and women have no power of decision over their lives, little or no education or health care, and that there is a preoccupation basically to marry girls as young as possible, and then they become pregnant very early in life, which makes it quite likely that their existence is basically determined by those facts. It was also understood that the low status of women contribute to the high mortality, the high rate of dying, especially for women and children, so maternal and child mortality. And the spread of HIV, which is a major issue in most countries, and also obviously then at the end to increasing fertility and increasing rapid population. And essentially, these take women's contribution away from society in a broader sense. So given these understandings, gender equality and women's empowerment were placed at the center of the international agenda for population and development for the first time, really, at the Cairo conference. And this did constitute a radical shift in thinking on these issues. It was really a shift of policy away from sort of the demographic approach, where we were thinking more in terms of numbers, to a more balanced approach to the human being and to individuals and to human rights. And essentially, also what happened there is that for the first time, issues that were considered before private and always just the domain of homes or household or hidden behind culture, that these were put into the public domain and there was a public discussion. So again, a major transformation. Private became public. It can be discussed. And so in Cairo, the leaders agreed, and I'll just quote this because it's a summary, very important summary, that the full participation and partnership of both women and men is required in productive and reproductive life, including shared responsibilities for the care and nurturing of children and maintenance of the household. So there was already 15 years ago internationally agreed a notion of balancing responsibilities also in the home, which is quite, forward-looking. So in the slide that you will see, it's actually very clear, and this is in the beginning of the program of action on ICPD. There are very important principles, and principle 4 really addresses gender. And maybe I'll read just one part of it. Principle 4 states that advancing gender equality and equity and the empowerment of women and the elimination of all kinds of violence against women and ensuring women's ability to control their own fertility are cornerstones of population and development related programs. So quite important agreements internationally. But the ICPD program of action also went further in the sense that it placed an emphasis on concrete action, so concrete policies, programs, and laws. And I'll just mention briefly 4 areas. One was to eliminate discrimination and violence against women. Another one was to improve women's access to secure livelihoods and therefore economic resources. And the third one was in the area of participation in public life, to remove impediments to women's participation in public life. And the last one was this balance of responsibilities in work and family. So again, very comprehensive and forward-looking agenda. And so essentially in articulating this vision and plan of action, the leaders who were gathered there for the first time agreed that every person has the right to sexual and reproductive health. Important, very, very important. And when I was thinking about this lecture, I thought to myself, well, maybe this agenda is not so visionary when we sit here in The Hague and in the Netherlands, or when I think about my own country, Finland, or several other places, even sometimes the United States. But it really was quite revolutionary, so to speak, because all these 179 countries represented all regions, all countries, all kinds of cultures, all religions, all beliefs, and they could finally agree on it. It was not without controversy. Some of you, many of you, might have followed the debate then, and maybe some of you were there. It was very heated, but in the end, what's important is that we did come together and we agreed, and it is an international consensus. So quite an exciting agenda, really. Now, let me just then look with you a little bit at the sexual and reproductive health as it was agreed, and it's contained in this document. In Cairo, delegates basically agreed that reproductive health, and here I quote, is a state of complete physical, mental, and social well-being in all matters that relate to reproductive system and to its functions and processes. So again, a visionary thought, because it's about health, but not only in physical term, in also mental term and social well-being kind of concept, so much more comprehensive. And reproductive health implies then that people are able to have a satisfying and safe sex life, and that they have the capability to reproduce and the freedom to decide if, when, and how often to do so. Very basic principle of human right. Therefore, reproductive health includes the right of men and women to have access, and this means how can they actually exercise this right? It means have access to methods of family planning of their choice, so there has to be choice, and other methods of fertility regulation which are not against the law. This is the reference to abortion, which was extremely difficult in the negotiations, but it is there. So reproductive health also includes the right of access to appropriate health care that will enable women to go safely through a pregnancy and childbirth, and essentially which will ensure that couples and individuals have a healthy infant. And reproductive health also includes sexual health specifically, and not merely only for counseling and care related to sexually transmitted infections, for example, or the health aspects, but also in order to enhance life and personal relations, says the document. Again, quite forward-looking. So in summary then, delegates in Cairo agreed that every person has the right to attain the highest standard of sexual and reproductive health and to make decisions concerning reproduction free of violence, free of coercion, and free of discrimination. And maybe also worthwhile to mention, there was also agreement on goals, very specific quantitative goals, and I will just only mention them in passing. One was the notion of universal access to reproductive health, to make sure that every person who wants